Hi there, it's Felicity from Bankery Spinal Health, and today I'm talking about a question that we get asked all the time. So, one of the things we get asked is can a chiropractor or osteopath help with sciatica? So, I wish there was a really straightforward answer to this, and obviously there isn't. Otherwise, I wouldn't do a video, but I'm going to try and keep it really succinct. And if I could shorten the answer, it would be yes, probably. Firstly, there are so many conditions that cause symptoms that could be classed as sciatica. I'm going to cover the most common causes in this video. However, this is not supposed to be a substitute for getting checked out and having a proper assessment with a qualified healthcare practitioner. Sciatica seems to be a really common term that we get asked about a lot, and I think this is because it's often a term that doctors will use because it covers any pain that follows the sciatic nerve. So that could be the buttocks, the legs, the thighs, or just general back pain. So it's a cover-all sort of term. It's not a term that we actually commonly use in clinic because it's not a diagnosis. It doesn't tell us anything. But we do see conditions in we do see patients coming in who have been diagnosed with sciatica. So it's a very, very common thing that we see. One of the things we see really frequently is patients who come in with a pain in the very lower part of their back, which might be radiating past their buttocks or into their thighs. And very often this is due to a problem in their facet joints or their SI joints. And these are the joints at the very bottom of your spine and the joints that join your spine to your pelvis. When these joints are really, really aggravated, they can refer pain down the legs. Not usually past the knee, but usually in that most common sciatica zone around the buttocks and the upper thighs is very common for radiation for a facet joint or an SI problem. What can also happen is the muscles around the hip and the buttocks become very, very tight and sore, and they can develop a phenomenon called a trigger point. Now, a trigger point is a point of a very tight band of muscle that is, the phenomenon part of it is that it refers pain around the buttock and into the legs. There are typical referral pain patterns for each trigger point. So usually we can spot a trigger point quite easily, just depending on where the pain referral is. And also we can recreate the pain by pushing on the tight bit of muscle. Trigger points are usually quite easy to deal with. The difficult part of trigger points is making sure that they don't just come back, because usually it's something to do with your daily life or your lifestyle that's caused the trigger point. And we want to make sure that that just doesn't keep happening. So we will usually give you lifestyle advice, exercises, tips on how to stop it reoccurring. Sometimes if your sciatic pain goes past the knee, or if it's very, very severe, or it's a sharp shooting pain, or you also get pins and needles or numbness or problems moving your foot, this may indicate what we call a disc problem. This is much more serious. We can deal with disc problems, but we do everything we can to help our patients avoid disc problems because they are more difficult to deal with. They take much longer to deal with, and once you have a disc problem, it's likely that that will be a recurring problem for you long term. So we are trained to deal with them, but we would rather that you didn't get to that point, which is why we always say to people, don't leave it, go and get seen. Now, there are some rare conditions that can happen with your spine, and particularly your discs, that can lead to severe leg pain, which require urgent medical attention. It's not something that we would deal with. I've only ever seen one in my history of 14 years of practice. However, it does happen. So if you are experiencing very, very severe pain, please go and speak to your GP, or speak to a medical professional as soon as you can. But like I say, that's very rare. But nearly all causes of sciatica are things that we deal with very, very frequently. But if you're not sure, then we do have an option of a free telephone consultation with one of our chiropractors or osteopaths, and they can give you some advice over the phone if you're not sure who to speak to about your particular problem. Okay, thanks. Bye.